Everyone has highs and lows. With the struggles and triumphs that come with everyday life, these mood swings are normal and healthy. But imagine if these feelings were extreme, your highs were even higher and your lows were even lower. This is bipolar disorder, a mental disorder marked by alternating periods of elation and depression. This concept was first introduced in 1854 by the French psychiatrist Jules Bipolar. He described an illness that caused recurrent oscillations between mania and depression, which he called la folie à double forme. Later on, the German psychiatrist Emil Kraepelin developed these ideas and coined the term manic depressive psychosis, after noting that periods of acute illness, manic or depressive, were generally followed by relatively symptom-free periods where the patient was able to function normally. People with bipolar disorder experience unusually intense emotional states that occur in distinct periods called mood episodes. An overly joyful or excited state is called a manic episode, and an extremely sad or hopeless state is called a depressive episode. A person who is experiencing a manic episode might have racing thoughts, become easily distracted and irritative, make impulsive and rash decisions, and have too much confidence and unrealistic belief in their abilities. A person who is experiencing a depressive episode might have problems concentrating and making decisions and feel tired and suicidal. Bipolar disorder can also be present in a mixed state, where a person may feel very sad or hopeless, while at the same time feel extremely energized. Bipolar disorder can be hard to prevent, since its cause is thought to be 60 to 80% genetic. However, there have been repeated findings that 30 to 50% of adults diagnosed with bipolar disorder report traumatic or abusive experiences in childhood. Because of this, prevention of the illness has been focused mostly on reducing stress. In order to be diagnosed with bipolar disorder, doctors first rule out any other diseases that could be causing severe mood changes. Then, they diagnose the patient with one of the 4 basic types of bipolar disorder: bipolar I disorder, bipolar II disorder not otherwise specified, or cyclorhythmic disorder. Once diagnosed, there are numerous treatments available. A patient might be put onto medications such as mood stabilizers, antipsychotics, or antidepressants, or may undergo psychotherapy to provide support and guidance on how to live with their illness. People with bipolar disorder can expect to live a full and healthy life if they can manage their disease properly and have the right support system in place. Few recent studies have researched the financial impact of bipolar disorder, but it is estimated that $45 billion is spent annually on the costs associated with the disorder in the United States, and indirect costs, such as the loss of productivity in the workplace, are estimated to be about $38 million annually. In addition, people experiencing a manic episode may go on spending sprees or randomly decide to quit a job, and people experiencing a depressive episode might find it hard to go to work, which increases financial stress on the personal level. In teenagers, the symptoms of bipolar disorder can often go unnoticed or can be dismissed as the usual mood swings that come with adolescence. In addition, many of the medications used to manage the disorder are not recommended for teenagers because of their effect they have on hormone levels and proper development. Because of this, teenagers with the disorder often turn to drugs and alcohol to help them cope with their symptoms, and about 56% of adolescents who are bipolar have also struggled with addiction. Bipolar teens are at an extremely high risk for suicide, which is among the leading causes of death in 15 to 24-year-old Canadians, second only to motorcycle accidents. There is a considerable amount of research being done on the link between marijuana usage and bipolar disorder. Many people with this disorder use marijuana to self-medicate, but a new study published by Lancaster University has shown that usage increases both manic and depressive symptoms. The statistics that come with bipolar disorder are pretty depressing. 1 out of 5 Canadians suffer from some sort of mental illness, and 1.5% of Canadians suffer from bipolar disorder. Those who do generally consult 3 to 4 doctors and spend more than 8 years seeking treatment before they receive a correct diagnosis. Suicide is the #1 cause of premature death among people with bipolar disorder, with 15 to 70% of taking their own lives as a result of the negative symptoms that come from untreated illness. A person who is bipolar will experience 8 to 10 manic depressive episodes in their lifetime. Even in casual conversation, bipolar disorder can be stigmatized, with people using expressions such as, "Oh my god, she's so bipolar," without realizing the implications of their words. In order to fight stigma, speak out about bipolar disorder, and fight back against any myths and preconceived ideas people might have about the illness. Self-stigma, or the belief that you are weak or damaged because of your own illness, is also a huge issue when it comes to bipolar disorder. To fight against this, focus on your strengths, not your limitations. Join support groups for people your age who are also experiencing a mood disorder. Together, we can stop the stigma.